Ask any gynecologist or a fertility expert and they'll tell you how a simple process of baby making actually might become so difficult for some couples. Pregnancy is not just about egg and the sperm. There's a lot which goes around them to make the right things happen. So hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So continuing with our infertility series, today we will be talking about the tube test. So before that, let's understand what are the tubes. So there are two fallopian tubes present on the either side of the uterus, right and left. The fallopian tubes are actually very thin, delicate but muscular tubes. They are actually almost 10 to 12 centimeters long, almost of the size of a pencil, and they vary in diameter from 0.5 to almost 1.2 centimeters. The end which is close to the uterus is very thin and narrow, while the end which is close to the ovary is very broad and has finger-like projections which are known as fimbria. So the fallopian tubes have actually four important functions. Number one, the tubes transport the mature egg from the ovary towards the uterus. The second, the tube pushes or lets the sperms travel towards the ovary. Third, it makes the fertilization possible. The egg gets fertilized by the sperm in the tube itself. The fourth, the fertilized egg is now transported back to the uterus for the implantation. The fallopian tubes could get damaged because of the previous uterine or genital infections, endometriosis, previous ectopic pregnancies, making the important process of fertilization impossible. So according to most of these statistics, the tubal factors or the problems of the tubes are the reasons for almost 10 to 30% cases of infertility. So evaluation of the fallopian tubes is an important test which is required in case a couple is finding difficult to conceive. So today we will talk about a test which will tell us if your tubes are healthy and patent. So today we have Dr. Prachi Benara with us. She is a senior fertility specialist and today we will be discussing about the tube test. So when is the tube test recommended?
So thank you Dr. Anjali and hello everyone. Any couple who has tried for more than 1 year with regular unprotected sexual intercourse and still not able to achieve a pregnancy should consult a fertility specialist or a gynecologist and get the tube test done.
So do you go for the tube test right in the beginning?
Not exactly. First, the consultant would conduct certain investigations like an ultrasound for the woman, semen analysis for the partner, and then proceed towards the tube test.
So what are the type of tubal patency tests which are available?
So generally we do tubal patency testing through three ways. Number one is Hysterosalpingography or HSG. Second, SSG or the saline bubble test. Third is a small surgery called laparoscopy to test the tubal patency.
So Dr. Prachi, what is the right time of the menstrual cycle to go for this test?
So one should be very certain that she is not pregnant before we advise her the test. This is generally done in the first half of your cycle once you finish your periods, generally within 10 to 12 days of your cycle.
So how does a woman should prepare for this test?
So when a woman visits a gynecologist for this test, please share your complete history. If you have any known allergies, let your doctor know. Share your husband's semen analysis, share your ultrasound reports. If there is a history of active vaginal infection, abnormal bleeding, painful periods, please let your gynecologist know about these things before she takes you up for this test. So what is an HSG test and how is it performed?
So the HSG or the hysterosalpingography is a test in which a radio-opaque dye is pushed inside the uterus. Once the dye is pushed inside, it outlines the uterus and outlines the tube. Radio-opaque dye means that it's a dye which can be seen on the X-ray. So once the dye is pushed inside, we can actually see the cavity, we can see the tubes. So how is the test done? So for this, on the day of the test, you are supposed to report to the radiology department of the hospital. There, a gynecologist and a radiologist would be there to supervise your test. Before the test, you will be asked to sign an informed consent form. A doctor might give you a painkiller injection or maybe a sedative injection. Then you will be asked to change into the hospital gown and remove your lowers. Now you will be made to lie down on an examination table with your legs bent. Now a doctor would put a lubricated vaginal speculum inside your vagina to visualize the cervix. So cervix is the mouth of uterus. Now we put in a small instrument which is known as the HSG cannula. Through this cannula, we actually push in the radio-opaque dye. So the doctor pushes in the dye and at the same time, the radiologist takes the X-ray. The doctor might like to take 2 or 3 films to see if the entire uterine cavity or the tubes are completely delineated. And after the doctor has got the perfect films, the instruments are removed and you will be asked to change back into your clothes. Post procedure, we like to give a small course of an antibiotic, we may give a painkiller, and you will be asked to report for a further consultation with your X-ray films, maybe after 3 or 4 days. So, Dr. Prachi, is this test very painful? This is the most common query which every patient asks us.
So, it is a little uncomfortable. To ease you, the doctor would give you certain painkillers, sometimes a sedative, and very rarely you can also request to go ahead with the test with general anesthesia.
So, can there be any complications of this tubal patency test?
Yes, sometimes you may suffer from nausea, vomiting, dizziness. Sometimes you might have a little bit of fever or infective signs. Very rarely you might develop an allergic reaction to the dye which is used for HSG testing. But don't worry, most of the hospitals are well equipped to handle such situations. So, what do we do when we find the tubes blocked?
So now this is something which every couple is worried about. Now the test has shown a block. What is to be done? So the treatment of the tubal block depends upon whether both the tubes are involved or whether it is a single tube and what is the site of the block also. Most of the tubal blocks can be successfully opened through the endoscopic surgeries. After the HSG test, when can the couple plan for the pregnancy? Now this is most of the people ask because people are worried if the X-ray radiation used in the procedure can harm the pregnancy.
So you ovulate after the procedure, that's why the test is done in the first half. And the dose of X-ray which is used is very minimal. So please don't be afraid. If you do not have any definitive signs of infection, please go ahead, try for a pregnancy.
In fact, we have seen that tubal patency test actually acts like a treatment also. So in case there are any minor flimsy blockages in the tube, when the doctor pushes the dye very hard, the tubes actually get flushed out. So it is actually a very good idea to try in that cycle. In fact, it is said that the best chances of conception are within the next maybe 3 or 4 months after the tube test. There are few infertility tests or investigations which can actually give us a very useful information and can actually at the same time improve the chances of pregnancy. So, thank you very much Dr. Prachi for being on our channel, and like always today, if you found this information useful, please do not forget to subscribe and share and like Maitri. And you can also subscribe to Maitri by clicking the icon at the right lower end of the video. And I will see you soon.